Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department here at MCHD. I'm talking to Helen Guthrie and Reba Pendleton. They are both behavioral health professionals here with Family Health and MCHD. Ladies, thank you for being on Wellness Wednesday.
Thank you for having us.
Now, this is Mental Health Awareness Month. It doesn't mean that the other 11 months out of the year we don't think about it. It's just that we focus and we highlight mental health awareness specifically in the month of May. So some of the things that you all have been dealing with as therapists have been some issues that have been plaguing adults and issues that have been plaguing adolescents, youth. So can you kind of give me a little bit of an overview about what you do, like the different types of therapies that you offer?
Okay. What we do is we do a combination of motivational interviewing, which is open-ended questions, as well as cognitive behavior therapy, where we speak to our clients about how they have possibly an ill manner of thinking, of trying to do things. And so what we do is have them rethink of it in a positive way. We also do dialectical behavior therapy, which is a specific therapy for cognitive behavior therapy, and that helps and deals with the emotional part of regulating your emotions.
So there's a lot of agitators out there right now that are going on that kind of, accentuate every other real world problem that's going on right now. So we call it stress and anxiety and things like that. So can you talk a little bit about some of the different stressors there are right now that people are having to deal with?
Because the most prevalent one is COVID. One of the stresses is being able to manage your finances. Are there going to be the risk of having the COVID, come to your home, as well as isolation, not being able to see your loved ones, as well as the stress for the balance of work, home, and school. A lot of families had to transition to online learning in regards to that, as well as being able to see loved ones that are in the hospital or saying goodbye to loved ones who have passed on. Those are stressors because we are a society where it's very communicable, that we have to have those relationships. So those relationships have been strained. And so that's some of the stressors that we're facing, as well as for the finances. Groceries keep going up, bills keep going up, and then loss of job.
And with children, anything that stresses their parents also stresses them. The best indicator for mental health in a child is that their parent has good mental health. So anything that stresses or causes problems for the parent also causes problems for the child.
Yeah, we were talking when we were speaking about finances and things like that. We were talking in terms of like being in an adult world, but we can't forget about the other side of it. So Reba, you mainly deal with adult health, and Helen, you deal with pediatric or adolescent health. So let's shift over to the other side of it here, like you just mentioned. So if it's bothering an adult in the family, and there's different types of families, right? Not necessarily a household with just mom and dad, but in that household, if there's something that is bothering an adult, well, kids are like little sponges, and it's osmosis, right? So it's definitely affecting them. So what are some of the stressors that have been bothering adolescents and children during this time?
A lot of the stressors have involved kind of the isolation, as families got kind of all cooped up together without a lot of other outside influences. Things just got tense in families. They're all cooped up in a small space. People get angry at one another. With teenagers in particular, I've seen a big rise in anxiety in general. and social anxiety in particular as they transition back from virtual learning to in-person learning. A lot of people who had any tendencies towards anxiety, that's gotten much worse while they were isolated from everybody. Particularly with older children, because those children are used to a lot of their contacts or friends and things. With younger children, most of it's their parents, even when they're in school in person. But with older children, their peer group is usually very important to them. So losing that was difficult.
Yeah, we are social animals. We thrive on that interaction with other people, to be that in-person close proximity. One of the first things you do when you meet someone you don't know, you stretch your hand out, it's that physical touch. So if that is missing, then all those other components are all out of whack. So yes, this has been a very difficult world for adolescents to live in. Not that it's any better for adults. We just adults tend to hide it a little bit better. I mean,
Right.
kids, they don't. They have no filter, so they just speak it. So they don't know how to hide it. So when people come to see you, you engage in psychotherapy, or sometimes we don't like to say that because people hear the word psycho and they think, well, what is that? Well, actually what it is talk therapy. You talk through the problem, you try to get to the core of the problem. So but some problems can't just be simply addressed by talk therapy. It has to be supplemented also too, maybe with several medications or things like that. So if someone wants to come see you, they can call our appointment line, but they can't just see you. They have to see, a provider first. Can you talk a little bit about that process?
Sure. What happens because we are licensed professionals, you have to see a provider here at any of our 8 locations to get the referral sent to us. And so when a patient calls, they can make their yearly, or if they're having any kind of problems or complications, they can say, when they speak with the doctor, once they have the appointment, they can say, hey, I've been having these symptoms of stress, or dealing with anxiety or depression, and the provider can do a referral to behavioral health. And usually we try to see the patient hopefully within that week, because it is Helen and myself. And so we divvy it up between the both of us.
And that's really good too, that there is that very strong relationship between, medical provider prescribing medication to, licensed behavioral health counselor. So there is that handoff there, and it's very important also too for a provider to pick up on those signs, if they're nonverbal, or, they have a lot of training, so they know what they're looking for. So it's easier to help them refer off to you. Helen, I think you've got some stats there that are kind of important to kind of talk about during this period of time. So, there are people out there, they like numbers. So can you kind of talk about some of those numbers? Because they're, when we talked and you mentioned some of those percentages to me, it just kind of puts it into perspective. So if you can kind of go through some of those, that would be helpful.
Okay, well, one thing a lot of people don't know is that mental illness frequently starts among the very young. 1 in 5 children aged 2 to 8 is diagnosed with some sort of mental, behavioral, developmental disorder. And COVID has increased disorders, I think, among everybody, but particularly older children. And so some of the studies that have been done with high schoolers during the COVID, specifically last year during 2021, 37% of high schoolers said they were experiencing poor mental health, and 44% said they were having persistent sadness or hopelessness. It was even a larger percentage among children who are gay or bisexual. The numbers were higher for females than males, but both were having problems.
I mean, those are some pretty strong numbers. When you say 37%, I mean, that equates out to be roughly 1 in 3. So that's, right. That's pretty powerful as far as a number. And then the other 44%, that's almost 1 in 2. So, these are things to be aware of. And we'll also post these numbers along with, supporting this. And then the other numbers like the appointment line, which I'll go ahead and mention. So for someone to be able to get to you all, they would call here to get an appointment with a provider, which is 251-690-8889. They would see either an adult or a pediatric provider, which would then in turn refer them to you. So there's that. But there's also other numbers too. There's, there's a suicide prevention line, and then, there's always 911. And, if you're in a crisis, you don't want to call the appointment line and try to talk to a provider and then get to you. You want to go ahead and intervene as quickly as possible. So, we'll mention those numbers also too in the notes that, like I mentioned, that go along with this. So is there anything else you'd like to add about this, or something we didn't talk about on Mental Health Awareness Month? But also, remember, let's, remind other people too, there are another 11 months in this year that we don't need to forget about this. So anything else that we need to mention?
I think for us is that we do a lot of, with our patients, that we utilize their coping skills. We always tell them that we're on this journey with you and you're the expert. Though we have the knowledge, we work with you with what you already have. And so a quick little thing that we both have learned, what we call the PRN technique, which is pause, reset, and nourish. And so when you pause, like when you're feeling anxious or frustrated or angry or isolated, or you have those ruminating negative thoughts that I'm not good or this or that, you just take a pause, just take a deep breath. I know everyone says it's easy to breathe, but if you take that pause and actually focus in on how you're breathing, it helps kind of recalibrate you. And so just take 3 deep breaths if you can, and just kind of check in with yourself. It's like, why am I feeling angry? What's going on? Who can I talk to, or where can I go positively to kind of help reset me? And then with the reset is like, look at something funny, appropriate, especially like for adults. I know our work life is busy, our family lives are busy, but when you get to that point to kind of reset, think of something positive, think of an affirmation, think of something that you're grateful for, or watch a funny cat video or a dog video to kind of help reset you. And then the nourishing is also to replenish yourself with something positive, like reading, positive affirmations again, gardening, journaling, and also coloring. Adult coloring books are great, just like the kid coloring books. And take that time to color with your family.
Yeah, I think, we didn't talk about what category that falls into, but, that's a lot of self-care stuff. So, these are very important things that people can do when they're not sitting with you and speaking with you, or they're not seeing you at this particular time, or they may see you, one day during the week, and then, what do they do for the other 6 days? So these are very important. So there's a lot of very helpful self-care tips that you shared, and I appreciate that. Well, let's wrap up. I don't think there's anything else that we forgot to mention about this, but thank you for being here. And let's just kind of let's breathe for ourselves just a second. We'll take 3 deep breaths. Oxygen is good for your brain, it's good for your body. So ladies, thank you very much for being on Wellness Wednesday.
Thank you
for having us.